Hi mamas, welcome to video 2, Understanding Postpartum Depression, Anxiety, and PTSD. So after childbirth, many mothers experience hormonal changes, emotional, and even psychological changes. Some mothers may develop postpartum anxiety, PTSD, and the one that we commonly all know, postpartum depression. And these can all be related back to a mother's birth experience. And as we all know, you go from being at the hospital to now going home with the newborn baby. Not only do you have to take care of your baby, but you also have to take care of yourself, which can be overwhelming and stressful. This can affect our mood, our sleep, our routine, and even a mother's ability to adjust to her new role. So by understanding these experiences, we can better support maternal mental health and recovery. And just a quick disclaimer, if you are experiencing one or more of these symptoms, it doesn't necessarily mean you have those mental health conditions. So how does postpartum mental health connect to occupational therapy? So before we get started, postpartum mental health is more than just a mood. It can affect a mother's daily life, including difficulty managing her routine, not having that balance of self-care, newborn infant care, household chores. That can definitely add up and be overwhelming and stressful for a mom. This can also mean having challenges bonding with their baby, having lack of motivation, or even experiencing disrupted sleep. So occupational therapists can focus on establishing a better routine for mom, promoting that mother-infant bonding, and lastly, teaching those self-regulation skills for mom to incorporate whenever they do feel overwhelmed or stressed. And some of these self-regulation techniques may include journaling, mindfulness, and breathing strategies. So we'll get into more of that in our next video, so stay tuned for that. So now that we covered occupational therapy's role within postpartum mental health, we can now get into some of the contributing influences of postpartum mental health, which are the societal pressures of being that perfect mother, traumatic birth experiences, pre-existing mental health challenges, experiencing grief and loss, financial struggles and limited access to healthcare, minimal social support, and lastly, feeding your baby. So the societal pressures of being that perfect mother, meaning that urgency to bounce back to our pre-pregnancy weight, or just simply being that perfect mother that doesn't deal with any mood or hormonal changes, never gets overwhelmed or stressed. I'm telling you right now, that's all fake. Especially when we go on social media, it's so easy for us to compare ourselves to other women. We see the Kardashians that immediately bounced back to, having that perfect body after giving birth, but that's unrealistic. And unfortunately, it does take a huge toll on our mental health. So I know it's easier said than done because I sometimes even compare myself to other women, and it just happens to be unintentionally. But give yourself grace. Your body just went through something extremely traumatic. Whether you went through a cesarean or a vaginal birth, it's still really traumatic for our bodies. So give yourself grace, be kind to yourself, and lastly, love yourself. Love every inch and part of yourself. Love your body, love your belly, love everything about yourself, because I know there's no such thing as being a perfect mother, but you're doing the best you can, and that's more than enough. And you got this. So some factors that can contribute to a traumatic birth experience are unexpected birth complications, when a mother feels fear or helplessness during the birth space, high-risk pregnancies such as preeclampsia or gestational diabetes, emergency procedures like a C-section, and feeling dismissed or ignored by healthcare providers, And lastly, believing that her and her baby are in danger. So some mothers may develop PTSD, which can include nightmares, emotional numbness, intrusive memories or flashbacks, and difficulty bonding with their baby. Some risk factors for traumatic birth experiences are poor communication from healthcare staff, prior trauma such as sexual abuse or previous trauma history, previous mental health concerns, and an emergency or complicated birth. During a traumatic birth, the body responds in a fight or flight mode, which again is the stress hormone, and this can increase the risk of developing both PTSD and postpartum depression. So they can both coexist together. If you have one, then you probably have the other. Research has shown that some healthcare providers usually will forget to look at the other postpartum mental health conditions. But again, talk to your healthcare provider if you feel like you are experiencing one or more of these symptoms. Pre-existing mental health challenges. Let's talk about it. So any mom can develop postpartum depression. However, if you have had a history of depression or have family members who've had depression or other mood disorders, your risk of postpartum depression can increase. So you know your body the best, and if you've had depression in the past and you know when you're kind of getting those symptoms or signs, then ask for help. Be like, hey partner, I'm not feeling the best, or call a friend. Tell someone that you trust and that you know is fully going to support you to try to get you out of that episode. And the best medicine you can do for your body is breathing techniques and movement. So moms, it's okay to grieve the birth experience you wish you had. Mothers who felt unsupported, dissatisfied with their care, or not listened to at all during the birth space are at higher risk of postpartum depression. One friendly, warm tip is to advocate for yourself continuously. If someone in the room is making you feel uncomfortable, whether it's a family member, a nurse, a doctor, you have every right to kick them out of that room and ask for another healthcare provider if needed. Remember that your voice matters the absolute most during your birth space. So don't be afraid to advocate, don't be afraid to speak up for yourself. So financial struggles can develop postpartum depression because mothers are constantly experiencing thoughts of financial burden or increased stress and emotional distress regarding their income. If you are someone that is experiencing this, try to connect with the community for free resources like diapers, car seats, or even formula. So having minimal support can cause postpartum depression because not only are you juggling hormonal changes, but if you're a first-time mom, this can be overwhelming. No amount of books or even educational resources could help prepare you to become a mother. I feel like you kind of learn to become a mother through experience. And if you're a mom of two, this can definitely be overwhelming because now you have to give both of your babies your time and attention, and it often leaves you to not having any time or energy for yourself. So if you have at least one person by your side who loves and truly cares for you, then that's all you need. But if you don't, then create your own support system. I would advise you to join any Facebook groups or look for any community events near you to help you get connected with your community. Because when you have at least one person on your side, that can make the world of a difference. Breastfeeding. Let's talk about it. So we obviously hear the positive side of breastfeeding, but no one really talks about the negative side, which can honestly be such an emotional toll for some mothers. Breastfeeding can be physically painful or uncomfortable due to low milk supply or latch difficulties. The societal pressures of mothers having to breastfeed can cause added guilt and shame. And breastfeed can cause sleep disruption as well, and again, be emotionally overwhelming. So, if you're someone that's currently experiencing this, I encourage you to do whatever makes you happy. And I know this is gonna sound extremely selfish, but remember, you need to put yourself first. In order for you to even take care of another little human being or even a whole village, you need to make sure that you are emotionally, physically, and mentally good above anything and anyone else. So, whatever it is you decide to do, just know that you need to put yourself first. So, postpartum depression affects 1 in 7 women, and this goes beyond sadness. It can affect a mother's nervous system, sense of self, her routine, and it can also impact a mother's energy, appetite, sleep, emotions, and even connection with her baby. Postpartum blues versus postpartum depression. Let's talk about it. So, postpartum blues, also known as baby blues, affects 50 to 70% of women shortly after delivering, and this can usually happen within the first few days of postpartum. Symptoms may include crying, sadness, anxiety, mood swings, feeling overwhelmed, sleep or appetite changes, but they typically resolve within the 2 weeks without any treatment needed. However, postpartum depression affects about 1 in 7 women and is more severe and can last up to a year or longer. Postpartum anxiety involves persistent worry or panic that can feel overwhelming or difficult to control. Mothers may experience intrusive thoughts or fears about situations that may never actually happen. It can show up physically, such as restlessness or tension, emotionally, such as constant fear or irritability, and behaviorally, such as avoidance or difficulty relaxing, all of which can negatively impact our well being and even our day to day. Postpartum PTSD can develop within weeks or even months after childbirth, and symptoms may include nightmares, sweats, anxiety, avoiding reminders of the birth, feelings of hopelessness, dread, regret, or even embarrassment, all of which can negatively affect the mom and her baby. So, risk factors that are linked to postpartum PTSD are prior history of mental health concerns, sexual trauma, childhood abuse, intimate partner violence, lack of support, and disassociation during childbirth. Postpartum psychosis, let's talk about it. Although it is rare, it is also a very severe mental health condition which can affect about 1 in 1,000 women after childbirth. Symptoms may include confusion, severe agitation, insomnia, paranoia, delusions, hallucinations, rapid speech, or even manic behavior. Because there is an increased risk of suicide or harm to the baby, immediate medical attention is critical, and treatment often involves hospitalization, therapy, and medication. If you are having those intrusive thoughts of harming yourself and your baby, please call 911 immediately. So, mamas, always remember that you are strong and capable. There is no shame in asking for help, and struggling with postpartum mental health does not define the type of mother you are. Okay, mamas, so before we end this video, I want you all to get in a comfortable position, whether that's laying down or even sitting up, whatever it is. And once you're in that comfortable position, I want you to sink deep into this moment and be as present as possible. It's okay if there's outside noises or distractions. Just try to push through. Okay, I'll give you a couple of minutes to be in a comfortable seated position, or honestly, whatever pose makes you comfortable. And once you're there, I want you to give yourself the biggest hug and close your eyes. Nothing in this space matters but just you. And I want you to repeat after me. Always remember, I am strong and capable. There is no shame in asking for help. I am enough for my baby. I deserve rest and care. I am not alone in this journey. I am allowed to take things one at a time. My feelings are valid. I am learning and growing every day as a mother. And I am doing the best I can, and that is enough. Now, whenever you're ready, slowly open your eyes. And yeah, that was the end of this video. Thank you so much for watching. Go ahead and please check out the video series. It's a 6-part video series. And next video, which is video 3, we'll talk about self-regulation techniques. So thank you for watching, and I hope you have an amazing day or night, whatever today looks like for you. And always remember those words of affirmations, because you deserve everything and more. Even if you don't believe it, you do. You deserve everything and more. And it's not easy being a mom, but hey, you're doing the damn thing. And that's more than enough.